Hello, everyone, and welcome to our session on basics of crafting your discussion as part of the GRRSP cohort 14, who have come a long way in terms of their 6 months program and will be focusing more on the writing skills of a discussion section. We've already discussed previously about how to write a results section, but the discussion section is its own art. And that's why I've used the word crafting here, because you have to kind of think beyond just the building blocks or the structure to it. So without further ado, um, we talked about the results section, and I think what makes the discussion section very interesting is how creative it gives you the freedom to be. So you have this responsibility now to be more of a master of how I want my discussion to look like. Each paper can be very different. It also has a subjectiveness to it, which means it is now coming down to the interpretations of the researcher, the authors, of their results. And some might even find it as one of the most challenging sections in the paper, because it really stimulates your mind to think, why is it that my results are the way they are? The aim, in very simple words, is to discuss your results, and to discuss sort of the results section of the manuscript. So let's not forget that the results are still the center of the whole discussion section. Even though we keep saying the word discuss and we may bring in other papers, references inside, it all comes down to connecting the dots to your results section. Now, when we say discuss, what is it that we really need here? Three things. You've got using other studies to either compare similarities or to contrast something in your results section, or and to explain the reason for your findings. So by comparing the similarities with other studies, you may have a certain result finding, and you are now comparing it whether that may be higher than the other study or lower than the other study. So that will either make it a similarity or a contrast. And you will attempt to explain why is it that there is a difference here. I'd like to first start by some tips on what is right and what could be good to make your discussion section even better. So before you start your discussion section, try to sit for some time with your results. You've spent a lot of time writing them, but go over them now, read through and find 4 to 5 key results that you've really come out of from your study, and see how each of these discussion points can be framed. So, what we like to do is have 4 maybe subheadings, or this could be an outline that you're creating. And each of these 4 main result findings would be discussed, uh, possibly in a paragraph of about 4 to 5 sentences. It's good to discuss this with your mentor as well, or whoever is supervising your project, to understand how you can explain those findings better or compare or contrast them better. The other tip is to write in second person or third person language, where it's going to be throughout the manuscript in terms of we or study or this study, and try to be variable in the way you're using this. I always enjoy reading it more when I'm seeing these variations at the beginning of your sentences rather than repeating we throughout the manuscript. When you're talking about from a third person point of view as well, it's about other studies. So a study by Nawaz et al., or a study conducted in 2021. This is the way you can frame the starting sentences. Also, past tense is the preferred way of writing in general. So anything would be was conducted, was done, rather than present. Also, a good thing to do would be to expand on your result findings. So the idea here is this is your space to actually talk more about your result, and not just your result, but the studies that you're discussing as well. So you might discuss another study here that is similar in finding or different in finding. And rather than just saying a study was done by X and it showed similar findings. As a reader, I want to know what are those similar findings. So expand on the numbers, the results, what exactly was similar. That's the purpose here. And this is something which we saw in the result, but also in the discussion where compare was if it was higher or lower or similar, attempt to explain why is it the way it is rather than just leaving the difference there for the reader to guess. So that why can be explained by reading more studies, or maybe sometimes your explanation can be biological. So why is it that biologically speaking this is making sense? Or maybe something happened in that time and you can try to connect and see, yes, that is the reason why the result is different from other studies. And the final point to keep in mind in terms of good practice and good tips is to keep citing throughout the discussion. This may be one of the most cited sections in your entire manuscript. So anything that you write has to be backed with evidence here. If you're comparing something, if you're explaining something, we need that explanation to have evidence behind it, which means you cite and reference either a research paper or a specific article that you found, or a news article as well sometimes can be referenced and cited. What not to do in a discussion section, and this is something which we commonly see, especially when you're early in the stages of learning how to write a discussion section. Don't turn it into a literature review of existing studies. You have the introduction section of your paper, which already sort of gives us a background of the literature. So we don't just want a repeat of that in the discussion. Um, the reason this turns into a literature review is that it fails to connect to your result findings. So anything you talk about, bring it back to your finding, your numbers, your results. Also, something that makes a poorly written discussion would be being very vague in explaining your reason. If you're not able to be specific and understand why is it that your result is that way, your readers are going to be left confused as well. And if you're not sure about it, you have the liberty to actually mention it in discussion that although there is limited research to explain why this is the case, or maybe further studies are required to understand the reason for it. But by using confusing words yourself, it may not keep the flow of the discussion well. Also, the way you compare and familiarize other papers, it needs to be done in a very neutral tone. So we don't imply critiquing other papers. This is not a critical appraisal of studies. You only mention how that study was different or similar to yours. And another common pitfall is looking at the order of your paragraphs. And we'll talk more about that and how to structure your result. But the way in which you've discussed your results, the first result finding, the second result finding, if it's not mirroring your original results section. So in the beginning of your results section, if you talked about demographics, then you talked about the gender disparities, and then maybe you talked about medication errors. Your discussion needs to follow that order of gender discussion, or whatever was matching with the results section. So these are some common mistakes we see. Now, moving to the more practical aspect of your structure here. So the structure is really starting off in a paragraph approach, and you can always divide and space it out when you're first creating an outline. First paragraph typically is going to be about 3 to 5 sentences that will summarize your key result findings that happened. And here you are just bringing back the result section that you've just written, but in a summary format. It could be something along the lines of, in our study, which was the first of its kind, our key findings were that these many were male, female, how many had a positive correlation. The reason for this is it helps the reader who has just finished reading your results section to take a breath, get a review, a summary, and then the discussion begins. So that's paragraph one. The remaining paragraphs, which is going to actually discuss the paper, are going to be talking about your result. So, for example, your first result, as well as that finding is being compared, contrasted, or explained. So sometimes you might compare and then explain. You might contrast and then you explain with another study and you reference them. And as you typically would have 4 to 5 paragraphs, depending on how many result findings you've selected, there's no set limit for it. Your final paragraph, concluding this discussion section, is going to talk a bit about the strengths of your study and the limitations of your study. And this is where your strengths need to be more than your limitations. So what are some strong points? Maybe it is your data size, your sample size was large. Maybe you had gone through a very strict methodology, and that could be your strength as well. You looked at different populations rather than just one population. So these are all examples of strengths here. Limitations can be in the form of maybe the language limitation that you did not cover, or when you were writing a review article, you missed non-English articles. A limitation can be in analysis. Maybe you did not get the opportunity to conduct a specific analysis format, or simply your study may have some biases. So in research, we have a lot of biases, and these biases could bias your result, and that could affect your study. So this is how limitations are written. And whenever you write a limitation, you back it up with what a future study could help and improve. So yes, our limitation was in the bias, selection bias, or recall bias. Future studies can focus on X, Y, Z. So immediately your limitation becomes neutralized, and you're no longer feeling that I have a weakness that I'm purely sharing. Some people might write a separate section called future research. So that is another way of writing your future study plan. This is another way of visualizing it. As we just discussed, your structure, you start with summarizing your key findings, you compare, contrast, and explain them paragraph by paragraph. And then towards the end is where you discuss the strengths. And when you're discussing the limitations, you might use that as a chance to talk about future study directions. That's it. It's really, when you break it down, it comes down to this formula. Now, when it comes to writing, it might feel overwhelming in some ways. And that's why we're going to use some examples of languages commonly found in a discussion section. So when you're comparing studies, these are some ways in which you can do, where you can talk in the form of prior studies showed that patients who had taken X number of medications developed these side effects. And then you reference that study. You can otherwise start your sentence by a research done by, and then name the author et al. In the specific year concluded that this happened. So the word concluded is a nice bridging word here between the sentences. Otherwise, you can compare by saying the results of this study either seem to confirm or are consistent with the findings of our study, or of a study done by X et al. So you can confirm when you're saying similarities or be consistent. Otherwise, you can say these findings are supported by research done by this. So your findings are, in a way, replicating another study there. So this is when there are comparisons of similarities that are being made. So whenever there's a similar study to your result finding. Other ways to do it would be these findings agree with, and then you name the author in bracket, or these are similarities between attitudes. There are similarities. This study corroborates the earlier findings, or they're consistent, seem to be consistent. All vocabularies that you can build, write, and use in your discussion sections. Now, if there is something that doesn't match with your finding, because you may find a contrasting study, right? So this is where you can use vocabularies like these findings did not support, were not consistent with our research or other research, or findings, did not have any evidence. No research evidence was found regarding this in other studies. This study has been unable to demonstrate a finding that was found by Kashyap et al. Or however, the findings of the current study do not support the study that was conducted by something in 1998. This has not been described in other studies. So simple, easy vocabularies that make it a very rich flow of writing. When you're trying to explain findings, so that's different from comparing or contrasting. Explaining is this result that we got may be explained by a number of factors, or a possible or a potential reason for this could be. So a lot of the times when we're trying to explain something, we may not be 100% sure about it, because at the end of the day, you're just hypothesizing sometimes. So you can say we hypothesize, or a potential reason for this could be this, this, this. the inconsistency or the discrepancy in result findings from other studies could be due to. And then you can quote that this is because our study had a younger age group, or a study mainly was focused on people with a certain disability. Future studies may focus on something else. So to summarize, you start off with really summarizing your key result findings. You then move to paragraph by paragraph, discussing your key result findings, which you've already decided in advance, how these findings are connecting to other studies, either as comparisons or as contrast. You then end with sort of discussing strengths, limitations, and future research. I also want to point a special consideration here for those of you who are working on social media research, where comparing and contrasting with social media data might look very different. So if you've got likes, comments, reposts that you've had in your results, you can compare with studies that have been done maybe with a similar topic or a similar hashtag. Sometimes you may not find a similar hashtag, and it's okay. You can try to compare to something close to that in a different population. Also explaining the activity timeline of posts. So there are results that come where we can see in January, February, how are the posts increasing or decreasing. This is very important for social media studies to discuss more. So I want to understand, why were there spikes? If there was an increase, is there a real world situation that happened, like maybe a health awareness day or a pandemic that caused the discussions on social media to increase? Again, this is all hypothesis. We're not able to directly correlate. So you may use something like, one reason for this may be, could be. And then explaining country representations. A lot of social media data can have different countries in different ranks. So you might actually explain why those countries may have a lower number of engagement on this topic, or higher number of engagement on this topic. Maybe they've got more education, research, awareness happening there, maybe less internet connectivity in other countries. You're free to sort of think of your own reasons, and that's why it's a very creative discussion. And then influencers, sentiment, which is emotions. Why is there emotion? Is it related to stigma? Co-occurring hashtags come up, these topics. Why are they connected? Why are they co-occurring with your hashtag? That can be discussed and explained using your own way of looking at the topic. So there's no right or wrong as long as you can reference and cite it well. Lastly, just remember that a discussion is a challenging section, but when you're writing your first draft, remind yourself that you're simply shoveling sand into a box so that later I can build castles. And that's something that I keep in mind. And you come back and you improve with feedback, with mentorship, and then you have a publication, hopefully. Thank you.
Thank you, Dr. Nawaz. I'll just add one thing at this point, is that the emphasizing on when you're writing a discussion that you are clearly denoting that this is your study result. And in our study, in my study, usually you say our study, which we noted, which is compared to XYZ et al. Has published it. So I see a lot of time where people write the studies that it's not clear. Are you talking about your results or you're talking about somebody else's results? So make sure Dr. Nawaz has covered that point. Make sure that you differentiate that well when you're writing a discussion section. With that, we'll end our video for today.